So testing the audio. Hi, Amy. Hoping you can hear us. Let me know if you can. We'll get started at 10 a.m. All right. Good morning, everyone. Welcome to today's, we are here to receive public comment as it relates to input regarding the 2025-2027 Louisiana CCDF state plan. Thank you for joining us on this Friday to provide comment. Before we begin, we're going to have two different screens. So at any point you notice a lag between said screens, just flag for me, because Karen and I are going to be DJing at the front to make sure for our live streaming friends, they see this as well. So for today, I wanted to provide an overview of how we'll approach today's public hearing. We're going to start with a very high level and very brief overview of the state plan. And then we're going to do feedback section by section, and I'll explain how we'll approach public comment section by section. And then we'll conclude today with very high level as it relates to next steps. And so before we go into the protocol as it relates to public comment, if you have not already, we did want to add the QR code to the state plan. One more, that's right. Thank you. If you have not already accessed the state plan itself, this QR code will take you directly to a draft of the report itself. And so with that, we wanted to speak over to the protocol that we will utilize today. So members of the audience wishing to provide oral comments regarding the proposed plan, we're asking, we're using the sign-in sheet method versus the card method since we're doing this section by section. And so if you have not already, and there is a section you're going to want to speak to, please ensure that you have signed with Dr. Vicki Silas over here. She will be calling out section by section. And we will be providing an opportunity to offer input each individual section, starting with any and all comments in section 1 before moving on to section 2 and so on. And so individuals signed up can provide public comments, and wishing to provide verbal testimony will be allowed up to 2 minutes. We will just be using cell phone timers as it relates, so we won't have to come up and down with screen, but we are asking for 2 comments per section for those individuals wishing to offer comments. And we're maximum at this of a 2-hour meeting. So we'll adjust as needed, but as of now, 2 minutes per section or per comment per section. And please note that we are live streaming today's public hearing. We're utilizing some new technology here up front that does pick up audio pretty throughout the room as well. So just being aware, but when you do come up, you don't have to press a microphone. It will pick up on the audio for our those joining via live stream. Prior to today's public hearing, we did receive some comments electronically via email and as well as the survey itself. And I'm reading out those who have provided those comments as of 8 a.m., acknowledging that I did not check this right before. So as of 8 a.m., I'm going to read out those that we received via email or via jot form. I'm going to read out their name and their organization. Candace Weber, Louisiana Policy Institute for Children. Christy Gilmore, West Baton Rouge, Ready Start Network. Cindy Rushing, Rapides Early Childhood Network. Jen Roberts, Agenda for Children. Christy Bardell, Children's Coalition for North. Paula Polito, Berry Cherry Tree Child Care Center. Farishay Perkins, Point Capee Early Childhood Coalition. Rochelle Wilcox, Wilcox Academy Child Care Center, and For Providers by Providers. Cerintha Strickland, Jefferson Ready Start. Teresa Falgas, apologies if I mispronounced. Agenda for Children. Kathy Giltree, Madison Parish. Michelle Ned, East Baton Rouge Parish. Patricia Thomas, East Baton Rouge Parish. Gloria White, West Feliciana Parish. Atrina Givens, East Baton Rouge Parish. Christy Gilmore, West Baton Rouge Parish. Elisa Munez, Louisiana Farm to ECE Work Group. Labrita Turner, Jefferson Parish. Ponis Devin Howard, Union Parish. Keith Leiterman, Orleans Parish. Jessica Roquette, Plaquemines Parish. Cerintha Strickland, Plaquemines Parish. Sissy Anclade, Jefferson Parish. Jennifer Stevenson, The Garden of Knowledge. Daisy Alvarar, Stella Learning Center. Danielle, Sugar and Spice. Pam Marshall, Shiloh Gardens. Jamie Martin, Munchkin Land. Troy Smart, West Baton Rouge Parish. And Rabbi Yossi Chesney. Jefferson Parish as of 8 a.m. And so with that, we also had a few individuals sign up, just not necessarily wishing to speak to a specific section, but expressing overall support for the draft report. And so Dr. Silas, if you could read the names and organizations that expressed overall support. Thank you. And so please note that today, if you're wishing to speak, only speaking to the recommendations for the 25-27 CCDF state plan and for that specified section. No other comments will be received at this time. A reminder that each speaker will be given up to 2 minutes to share their input per section. No discussion will be occurring in response to the comments. We're here, the department is here specifically to receive the feedback and or the recommendations of the public comments. And so to begin, we're going to do a very high-level overview related to the state plan. And I'm realizing I just dove right on in and I never said, my name is Malin Baker. If I have not met you yet, I'm newly supporting the Office of Early Childhood, serving as the Assistant Superintendent. And with that, I'm going to transition to Karen Powell, our Deputy Assistant Superintendent, to provide a high-level overview of the report. Karen.
Thank you, Malin. So as many of you know, the CCDF, or Child Care and Development Fund state plan, is something that the Louisiana Department of Education seeks input in for developing as lead agency for the CCDF funding. And so the state plan, we're going to give you just a little bit of overview, background, and the areas covered by the state plan. So CCDF is a block grant of federal monies distributed to the states and by the states. And it provides resources to enable low-income parents to work or to pursue education and training so that they can better support their families, while at the same time promoting the learning and development of their children. It also provides funding to enhance the quality of childcare for all children and increase access for families. And it strives to ensure that we improve the health and safety of children in childcare. And so CCDF and this plan covers all the areas that the LDOE supervises and manages in the state. So that includes licensing, the Child Care Assistance Program, or CCAP, child care criminal background checks, the workforce investments that we make, quality improvement efforts that we make, and access improvement efforts. And so these CCDF funds have played an integral part over the past several decades in preparing Louisiana's children for kindergarten. And so we invest CCDF funds in CCAP, as I said, in licensing, in our unified rating and quality improvement system, in enrollment efforts, in Ready Start networks, in our early childhood ancillary certificates, scholarships, in other professional development, in the Pathways Registry, in coaching and technical assistance, training, mental health consultation, high quality curriculum, bonus payments and school readiness tax credits, and the early childhood assessment system. And so the state plan is a standard document that every state uses every 3 years to demonstrate how the state lead agency is complying with all the federal regulations of CCDF. And so every state and territory is currently completing a state plan. We are all on the same federal cycle, and it must be submitted to the Office of Child Care by July 1st, 2024. The state plan is going to covers federal fiscal years, and so it will cover the state's plan for childcare for the next 3 years, beginning October 1st, 2024 through September 30th, 2027. It's important to note that the document as it stands today and as it is submitted as of July 1st does not lock the state in from further revisions. Revisions can be made at any time, and states often make revisions as circumstances or policies are updated and change. And so the state plan has to be written in such a way that it says what will be in place as of October 1st, because we will be monitored as of what policies have already been approved, what systems are in place as of October 1st. So as you know, there are many data systems that we are updating, for example, And so we have to write the state plan in accordance with what will be fully updated and launched by October 1st. But we know as we continue to roll out those systems that there will be amendments updating the state plan as they roll out. And so the state plan is broken into the following 10 sections, and I won't read them out right now because we're going to go through them one by one and list them as we go through them individually.
Yes. And I am going to catch up to you. Okay, all right. So we're going to start with public comment as it relates to section 1. Section 1 defines the administration of the program and describes the development of the state plan, including who the CCDF lead agency is and its leadership and entities and individuals who participate in the implementation of the programs and partners who were consulted in development of the plan. And so definitely want to acknowledge, thank you for participating in a part of that feedback process that we describe in section 1. And so with that, for pages 6 to 14, we're going to start with public comment, again, acknowledging 2 minutes. We will start our timer once you begin. And so with that, I will ask Dr. Silas, can you please let us know who has signed up to make comments related to section 1? Great.
First is Christy Gilmore with West Baton Rouge Ready Start Network, and Jen Roberts with Agenda for Children.
And if you could introduce yourself, I think our members listening to live stream aren't able to hear Dr. Silas. So before you begin your public comment, if you could just introduce yourself, that ensures that our live streaming is also able to hear that.
Good morning. I am Christy Gilmore from West Baton Rouge Ready Start Network, and I'm the coordinator there. My comments for section 1. I recommend that the department extend operational duties to local early childhood networks and coordinated organizations, including conducting eligibility determinations, disbursing payments, assisting parents in locating child care, and implementing quality improvement activities. Some of the benefits of extending operational duties is localities have been determining eligibility for B3 programs for many years now, and we have established ongoing relationships with B3 program families. This has allowed us to assist families and match them to centers and programs that best meet their needs. Because the agencies determining eligibility are located within the community that they serve, both applicants and providers are able to access immediate assistance with completing the application process in a timely manner. This has aided in a reduction of wait time for child care placement for eligible families. There is an upward trend in both timely payment disbursements and quality improvement activities due to local operational duties. In order to truly establish a strong and effective community network for early learners and their families, I recommend extending the B3 program's operational responsibilities to the local agencies during the fiscal years of 2025 and 2027.
Good morning, Jen Roberts, CEO of Children for Children. I also agree with everyone like to recommend the department extend its operational duties to early childhood networks. Coordinated enrollment has been one of the major accomplishments of Act 3. It offers families a one-stop shop in many parishes for applying for child care programs. And as a network, as an organization that is the code agency, we get better visibility into that supply and demand. Programs get assistance in filling those seats more rapidly. Noween here in Orleans Parish has operated a nearly fully unified enrollment system for almost a decade. And we have successfully been able to integrate CCAP B3, B3, ECEF, and local seats. 3 of those have the same eligibility requirements as child care assistance. So if local networks lose the ability to verify for that one particular set of seats, you are essentially asking families to apply twice with the same set of documentation. One would be locally, one would be at the state. And they have the exact same eligibility requirement. And that means that parents need to gather those materials twice, submit those materials twice, And we know already in particular, our parish and our regional parishes are some of the most vulnerable in the state. And so if you have concerns around transportation, if you have concerns around resources, that is an exorbitant amount of time that would take. I also think full stop, it would create an enormous amount of confusion after building a great deal of infrastructure to be able to support that work. So thank you.
Just gonna, flow. I'm gonna come over here and give this individual my book. Thank you for the reason. I will note that I think some of our listeners and some of the live stream are struggling to hear. So just noting to listen up as best. Okay. Section 1. Okay. Next up, Jennifer Stevens and Matt Batson. Sorry, I'm struggling to read. Batson. To speak to section 1.
Is there anyone else you can call next for Jennifer? She is still running, she's almost here, but she's not right there yet.
Sorry. All right, Rochelle, you're next. Wilcox from Wilcox Academy. Going in the order of the assignment.
I am Madeline Batson, Director of Policy and Research for the Louisiana Policy Institute for Children. The recommendations I have for Section 1 were generated by an informal working group of child care providers, Ready Start Network leaders, and child care resource and referral agency leaders. Located in Section 1.2, I recommend that the department extend operational duties to local early childhood networks and coordinating organizations. I recommend the department allow these operational duties to include conducting eligibility determinations, dispersing payments, assisting parents in locating childcare, and implementing quality improvement activities. As stated in the CCDF blueprint, the lead agency has broad authority to operate, which means implement activities through other agencies, as long as it retains overall responsibility for CCDF. Therefore, the department is able to continue their current procedure of allowing local networks to determine eligibility and disperse payments for the B3 program as they have been, even if the B3 program is pulled under the CCDF plan. I recommend that the department select in their chart on 1.2.2 the option to allow local government agencies and CCR&Rs to determine eligibility and disperse payments so that the department can allow local agencies who have proven to successfully run the B3 program continue to do so and work to support other local networks in reaching proficiency and determining eligibility over time. The department has shared in section 4.1.1 that providers encounter frustrations due to delays in processing family applications for CCAP participation. Additionally, difficulties arise when contacting the department. End quote. Allowing local agencies to determine eligibility would decrease the burdens providers and other stakeholders have stated they face in engaging with the CCAP process. Thank you.
Good morning. My name is Rochelle Wilcox. I am the Executive Director of Wilcox Academy of Early Learning. I am also the co-founder and CEO of For Providers by Providers. I am speaking to Section 1. I recommend that the department extend operational duties to local early childhood networks and coordinating organizations, including conducting eligibility determinations, dispersing payments, assisting parents in local child care, and implementing quality improvement activities. As has been stated earlier, as a provider, it becomes very cumbersome when parents are coming to you and then they have to do their application at the state level. That has taken a very long time, and there is a wait list for our parents to get a seat. At the local level, as knowing specifically in Orleans Parish, has displayed over 10 years in the coordinated funding enrollment, those things happen rapidly. There is actually live support for parents, including parents being able to come into the centers and get the support that they need and not having to wait. That has decreased the wait time, that has put children in seats. And in addition to that, meaning parents get to go to work. This is for working parents. We want to make sure that this opportunity exists. In addition to that, being paid in a timely manner from the lead agency instead of to wait for incremental payments from the state. We recommend that this stays in the lead agency to support parents, providers, and the workforce.
Probably say this wrong. Is it Farish Perkins? Mom? Did I say? I'm sorry. It's okay.
Jen.
Hi, good morning. I'm Farishay Perkins. I'm the mom of 2 kids in a type 3 early learning center, and I also have the pleasure of serving as the executive director of Point Capiz Early Childhood Coalition. I was able to attend the Teacher Leader Summit this week, and at one presentation, the speaker urged all participants in early childhood to create multiple avenues to support families. And I urge the department to take its own advice by capacity sharing with networks to administer B2 seats via CCAP for the next 3 years. The department's going to give itself time and margin to build out excellent data systems, and families will enjoy the locally responsive supports the CCAP B2 program has provided. Ecclesiastes 4:12 reminds us that a 3-strand cord is not easily broken. Let's use those 3 strands, network, department, and families, to build a bright path for our children.
There's no other comments for section 1. We will now move into section 2.
Jen Roberts, agenda for children.
In 1 minute, I love it though, but Jen, and then after Jen will be,
Stevenson.
yep. So if y'all wanted to come up, we'll do a very fast overview and then we'll start with that section.
So section 2 of the CCDF state plan describes how the lead agency defines eligible children and families and works to improve access for them, including by identifying how the lead agency works to reduce barriers to family enrollment and redetermination, prioritizes services for vulnerable children and families, conducts outreach to families experiencing homelessness, families with limited English proficiency, and persons with disabilities, and promotes continuity of
Hi, Jen Roberts, CEO of Agenda for Children. I have a couple of statements related to section 2. The first is that I recommend that the department reduce as many barriers as possible to increase efficiency by aligning with rather than exceeding any sort of federal documentation requirements for eligibility determination and for redetermination. As we operate in OME, which is a local network that administers both ECDF funding as well as CCAP B2 we have seen personally and documented extensively how state requirements that exceed those federal recommendations reduce low-income children's access to those seats, ultimately reducing their family's economic security and reducing the child's school readiness. There are a couple of ways that we would recommend improving this. The first is that eliminating or reducing the number of requirements for the number of hours worked to become eligible for CCAP. This is sort of a chicken or egg problem because it's baked into the child care assistance process because parents can't work or work as many hours they want unless they have access to childcare. And as most low-wage workers can't access childcare, can't do so without a job. We've also seen in our experience many single moms who are determined ineligible for those seats because they're only working 17 hours a week because they don't have childcare. And so if those moms could access CCAP, I'm confident that many of them would be able to work many more hours per week. And as the system sounds, we're kind of keeping those families, in particular those mothers, stuck in a cycle of poverty. The second key thing is that related to birth certificates for all children in the home and for pay stubs within 45 days, they are not required by federal regulations and they add administrative burden. I would also recommend that the department include homeless families receiving homelessness in its definition of children who receive or need to receive protective services. I would also recommend that the department prioritize enrollment of childcare employees following the leads of states like Kentucky. We have done this locally with ECEF dollars and CCAP B2 and initial feedback from our providers has been overwhelmingly positive. Prioritizing early childcare. For workers, when subsidized childcare is so essential, will help retain a workforce, which we all know is quite a bit of a crisis right now.
Madeline Parks Batson, Louisiana Policy Institute for Children, and Megan Garrison, Young Scholars Academy.
I am Madeline Karst-Batson, Director of Policy and Research of the Policy Institute, Louisiana Policy Institute for Children. The recommendations I have for Section 2 were generated by an informal working group of childcare providers, Ready Start network leaders, and childcare resource and referral agency leaders. Located in Section 2.1, I recommend that the department implement presumptive eligibility. This provision is currently only afforded to families experiencing homelessness. As stated in the Federal Administration for Children and Families final rule, evidence suggests that presumptive eligibility can be implemented with relatively low levels of financial risk for our lead agencies, and the potential benefits for families are substantial. Also located in 2.1, I recommend that the department continue and expand EC guides. EC guides have been instrumental in ensuring families understand and are able to complete the CCAP application process. In Section 2.2, I recommend that the department reduce barriers and increase efficiency by aligning with and not exceeding federal documentation requirements for eligibility determination and redetermination. The department should implement the Administration of Children and Families Model Simplified Application. The ACF, the Administration of Children and Families, states that the process of applying for child care assistance should not be complicated, confusing, invasive, or frustrating for families, end quote. However, what we know from conversations with parents, providers, and network leads is that the current process for CCAP is often burdensome, due in part to the requirements that go above and beyond what is required by the Administration of Children and Families. In Section 2.3, I recommend that the department expand the definition of protective services to include children who have been abused or neglected, as well as children at risk of being abused or neglected. In Section 2.5, I recommend that the department establish eligibility for at least 24 months. The CCDF preprint establishes a minimum of 12 months eligibility, with the determination process being one that is difficult for families and valuing continuity of care for children. Extending eligibility will relieve the redetermination burden and realize a more equitable system. The new CCDF final rule requires states to lessen the burden of administrative requirements of CCDF on parents. Extending the eligibility period would do that.
My name is Megan Garrettson. I'm the owner of a Type 3 facility, Young Scholars Academy. I recommend that the department extend prioritization of enrollment to include children of childcare employees. As a business owner, we know that we need workforce, and I have found qualified staff educators that are willing to work, but cannot work unless they have childcare. They are in need of childcare assistance. So I urge the department to take away this barrier for our workforce, and so that we can get educators in the field, open up more classrooms, and have more children that we can serve. I also recommend that we take away the barrier of needing more required documentation to make this a seamless process.
Christy Gibbons, Kids of Excellence. Rochelle Wilcox, Wilcox Academy.
Good morning. Well, hello, everybody. Good morning. I'm Christy Gibbons. I have 3 childcare centers in New Orleans. I've been in business for over 25 years, and I'm also co-founder of For Providers by Providers. And I'm here to talk about the challenges for parents renewing their eligibility for childcare assistance annually. You know, being in business over 25 years, this has truly been a burden for parents. The burden of renewing every year can be overwhelming for parents, leading to some families losing their childcare support. This disruptions not only affect the continuity of care for children, but also impact the ability of parents to work and support their families financially. It is crucial to address this issue to ensure that families can maintain stability and access the support they need for their children's care. So I am requesting that we extend it 24 months because it's really hard. I see my parents sometimes, you know, they're changing their phone numbers, they changing emails, they can't get access to it, or the documents were mailed out and they get it like 2 or 3 days before they're due, and they lose their childcare. And sometimes when they got to get back on there, they have to be put on the wait list. And this, I have saw so many children taken out of centers and have to come back. And these children really need to be in school because children have disability. They have no one at home helping them, supporting them to get ready for school. And the whole reason why we do this is get children ready for school. So if we can change this to 24 months, that could really support families and children. Thank you.
Good morning again. My name is Rochelle Wilcox, Executive Director, Wilcox Academy of Early Learning in Orleans Parish and co-founder of 4 Providers by Providers. I am speaking on several items in section 2. My first one is I recommend that the department reduce barriers and increase efficiency by aligning with rather than exceeding the federal documentation requirements for eligibility, determination and redetermination. In Orleans Parish, and I'm sure in every parish across the state, specifically this child care assistance, child care B3 are for our most vulnerable parents, which it is bringing in additional pay stubs within a 45-day period becomes a burden. Not only that, they have multiple children. Some children, they might have their birth certificates immediately. Others, they might have to go to vital records. If they are already in a place where they are not working, this is an additional fee that they have to incur in order to get the childcare that they need to support their parents themselves and work their ways out of poverty. I am asking that we align with the feds and lower the barrier or just meet the requirement that the federal government requests. In addition to that, I recommend that the department expand prioritization of enrollment to include childcare and for our employees, for childcare workers. I have literally tried to hire at least over the last year 8 parents that are looking for a space. However, as a small business owner and as a provider, a type 3 provider, it is a challenge when that parent can't work, right? There is a workforce crisis in early care and education across the country. We know that Kentucky has done it. I did 2 minutes per thing.
No, first section. And we do have 8 more to go. 8 more sections to go. Yes.
I know, I was thinking, I was like,
Mary Shay Perkins, mom, and Fatima Fillmore, NOLA PS.
Good morning. Again, I'm Fairshade. I'm from a rural community and I recommend the expansion of EC guides to rural areas through a regional EC guides model. The current 12 guides are doing essential work. What they're doing should be expanded for the entire state. I also recommend that the department expand prioritization of enrollment to include children of child care employees. Other states have implemented this because child care is the profession that makes all the other professions possible.
Good morning. I'm Dr. Fatima Fulmore, the Deputy Superintendent of NOLA Public Schools, and I oversee the enrollment and verification process for early childhood in Orleans Parish. And I also serve on the NOLA Steering Committee. As a product of poverty and an excellent public education that started with early childhood education at the age of 3, my family, like so many others in Orleans Parish and across the state, are trying to give their child a bright and early start to their education by ensuring their child is in a safe and supportive environment where they can learn, grow, and thrive. To ensure our children have access to these opportunities, I recommend that the department reduce barriers and increase efficiency by aligning with rather than exceeding federal documentation requirements for eligibility, determination, and redetermination. Currently, the department in some instances requires documentation or expectations beyond what is required by federal guidelines. The department also requires 4 pay stubs within 45 days, as well as birth certificates for all children in the household as part of eligibility determination. These requirements are difficult for applicants to provide and unnecessarily stall the determination process. I also recommend that the department establish eligibility for at least 24 months to help relieve the redetermination burden and realize a more equitable system for our children. I see these frustrations and barriers that these barriers create for our families. And when we make it harder for our families, we make it harder for our children and further disenfranchise children who are already some of the most vulnerable and highest needs served in our state. Thank you.
Pamela Marshall, Shiloh Gardens Academy. Tiffany Spears, Toddlers University.
Good morning. My name is Pamela Marshall of Shiloh Gardens Academy in New Orleans. I recommend that the department establish eligibility for at least 24 months. Because I feel that 1 year is just not enough time for anyone to come up out of poverty, even after going back to work, after going back into the workforce after a year. You still have not established enough funds, or you haven't got yourself established to where you have been able to, pay your bills and be able to still afford quality childcare for your children, especially in single household income families. We have families that even extending the eligibility period would minimize the stress of parents fearing that to lose their benefits due to a small increase in pay or promotions, and lack of communication between caseworkers and communication barriers of them receiving their documentations. Families that are, from my experience, I find that even families that are in the medical field and families that in education still cannot afford the co-pays for a lot of the childcare from the CCAP funding. And I think that extending this in 2 years, 24 months would also allow them that time to, take that stress off of them of having to get, documentation and have all those things ready for them for that. So I'm gonna go back because I skipped one. Section 2, I recommend the department. That's it. I just read that. So section 5, I recommend the department create a model of training. Oh, we keep going to, okay, well, that's why I'm coming back.
Thank you.
Okay, well, I'm done.
Thank
Michelle, you could have took some of my time.
Oh, good morning. Tiffany Spears, owner of Tyler University in New Orleans and Tyler University 2 in New Orleans East. I recommend, with the rising childcare costs to pay childcare teachers a living wage, I recommend that the department expand prioritization of enrollment to include children of childcare employees. This will help reduce the teacher shortage, and also other states have implemented this process. The majority of childcare teachers are still, unfortunately, living paycheck to paycheck. So this will also help our childcare employees. And when our employees don't have reliable childcare services, employers risk reduced employee productivity, increased turnover, mental health concerns such as depression and worry about who's going to keep their kids while they work, and also that leads to burnout.
Lametris Rogers, Tender Touch Nursery, and Jennifer Stevenson, Child Care Association of Louisiana.
Good day. I'm Demetrius Rogers with Tender Touch Nursery. We have locations in Richland and Franklin Parish in Northeast Louisiana. It was very important for me to be here today to represent Northeast Louisiana, so that we know that this is not just a South Louisiana problem issues that we're dealing with. In section 2, my recommendations are, I recommend that the department implement the presumptive eligibility, which would grant an applicant enrollment into CCAP while the department verifies their eligibility. I feel like if a parent is receiving SNAP or Medicaid, we have parents who have received SNAP and Medicaid, but don't get approved or get put on the waiting list, for childcare and basically end up losing everything because they are on the childcare wait list or they're not eligible for childcare or they lose their job before they can even move forward because they're not, their applications are not being processed timely. Consecutive hours, I feel like the 45 days for the requirement of having 4 check stubs within 45-day period of time causes issues because some parents are just not able to provide those consecutive paychecks. Some parents have 2 or 3 children where one child gets sick, they're off for a week here, then they working to make up hours, and then another child gets sick, they're back out, and they're not able to get those consecutive paychecks. So I think if we did like an average hourly rate rather than saying you have to have this many hours every week, that would make it easier. I also think that if we prioritize parents who are in the early education work field, those staff members who need childcare.
Minutes goes fast. Okay, good morning. My name is Jennifer Stevenson. I am the owner of the Garden of Knowledge in Buckaloosa and also a board member of the Child Care Association of Louisiana. Thank you for your time today. For section 2, my first recommendation, page 15, section 2.11, leveraging eligibility from other public assistance programs. As an administrator of the food program, we see this work. You just put in the food stamp card number and you automatically qualify, and it really speeds up the eligibility process, which could really help with the backlog that is plaguing the state. Page 20, section F, does the lead agency extend eligibility to specific populations or protective services? I believe that homelessness should be checked in this section. On page 28 in the chart, with homelessness, if we had a simplified application similar to what we did for essential workers during the pandemic, again, that could expedite the application process. On page 35, section C, subsection 3, a change in residency outside of the state. I feel really strongly that we should make exceptions to this. Living so close to the state border, I can think of several scenarios. A family might become homeless and the closest resource might be right across the state line in Mississippi, which is 10 minutes away from their home, but a whole lot closer than driving an hour to Covington. Or maybe a family recently moved, but they want to finish out the school year. So if the money's staying in Louisiana, if we could consider if they live within so many miles of the state border and for a certain period of time, just to help reduce their trials and tribulations that they're going through, and being so close to the border, we do see this often. And that's all I have to say.
With no further comment to section 2, we will now move to section 3. Section 3 is related to child care affordability and care assistance provided to families. This section identifies determining eligible families' contributions to payments, how to make contributions to payments affordable, how to access improved for vulnerable children. Some of the sections that is specific to pages 38 to 42, Louisiana families at a 64% or lower SMI have no state co-payment requirement. And in Louisiana, co-pays are waived for children in foster care, as well as the STEP strategies to empower people program. And so with that, we will now open public comment as it relates to section 3.
Madeline Batson, Louisiana Policy Institute for Children. Megan Garrettson, Young Scholars Academy.
Hi
am Madeline Batson, Director of Policy and Research for the Louisiana Policy Institute for Children. The recommendations I have for Section 3 were generated by an informal working group of child care providers, Ready Start network leaders, and child care resource and referral agency leaders. In Section 3.1, I recommend that the department waive co-payments for all CCAP enrolled families, or implement a policy similar to that of California, who does not require co-payments for families earning less than 75% of the state median income, and capping at 1% for families who make more than 75% of the state median income. At the very least, the department could extend co-payment waivers to children of child care workers and children with special needs.
Megan Garrettson, owner of a Type 3 Center, Young Scholars Academy. I recommend that the department maintain pays for all CCAP approved families. The B through 3 program has operated without co-payments. Best practice would be to eliminate co-payments for CCAP voucher families in addition to B3. I want to be clear, I do not want the burden on child care providers. As a business owner, our margins were already small. With inflation and the rising food costs surpassing 50% has closed that gap completely. Getting parents and educators back at work and on their feet would be at a faster pace by eliminating this barrier and help our workforce thrive and help us serve more children. When, just to note, like when we have educators that want to come to work, but they need childcare assistance, once they get that childcare assistance, they don't have a paycheck. So it's a barrier to them trying to figure out how they're going to pay that copay. So by waiving that, it would allow them to get to work. We could open more classrooms and we can serve more children with also eliminating that barrier. Thank you.
Christy Gibbons, Kids of Excellence. Parashay Perkins, mom, PCECC.
Good morning. Well, I'm Christy Gibbons again, and I'm talking about waiving the co-payments for families, for the CCAP program, because you all have done that for B3. And what I see every day at my center, we have a crisis going on in this world right now. We got rent increasing every year. We have food prices going up, look like every 3 months. I have kids coming to school. I have to feed 3-4 times because they're hungry. I have a parent that is homeless. I have a teacher that is homeless, that she has a child at my center, and thank God for Agenda them that they were able to give her a seat about what they talked about early, that she can at least have her child at the seat. They don't have cars, they can't afford gas. And it's a burden on us because we're running a business and we feel this burden. But we have to still charge them this price. But the parents really cannot afford it. They cannot afford it. There's just not enough of money they're making to afford co-payments and also pay the bills that they have to pay every day. I see people changing houses every 6 months, changing their phones, can't pay the utility bills, going to TCA because they can't pay these bills. So if we could eliminate the co-payment, that could at least be a start to help them to be able to be financially, to at least to know they can bring their kids to school every day so they can at least continue to go to work and not lose access to going to work because the child have to stay home because the center say you don't have co-payment, so you can't come to work. They can't come to school today. So I ask you all to waive those payments for CCAP parents too.
Good morning, Parashay Perkins, Point Early Childhood Coalition, Mama 2. Rather than have a system of multiple co-pay requirements that differ based on the funding source, I recommend that the department create an aligned co-pay requirements for all CCAP approved families. And this could be accomplished exactly by aligning the CCAP co-payments to what has already been proven successful through the CCAP B3 program. Thank you.
Tiffany Spears, Toddlers University. Demetrius Rogers, Tender Touch Nursery.
Hi, Tiffany Spears again. I recommend that the department waive co-payments for all CCAP approved families. Basically, most of our CCAP families are still considered low-income families, and some of them have multiple children, birth to 5, which can equal multiple co-payments. Currently, I have families that have like $46 a week co-payment, $65 a week, and I have to work with those parents just to meet those co-payments. So, as providers, as they previously stated, you know, we want to make sure the children have a safe place to go. And so we work with those parents, even with those co-payments. So with these families being low income, eliminating those payments will be helpful. And again, it will reduce the burden on them.
Good morning. Monique Rogers with Tender Touch Nursery. We're located in Richland, Franklin Parish. Again, this is, I want to emphasize that this is not only a South Louisiana issue, this is a North Louisiana issue as well. And I agree with most who've spoken. We implemented a program, Birth to 3, without co-pays. If we could implement that with child care assistance, that would give parents one less thing to worry about and put them on the track of moving forward and building and getting back where they need to be.
Jennifer Stevenson, Child Care Association of Louisiana.
And if it per section 3, we'll now move to section 4.
Section 4 of the state plan highlights how providing access to a full range of providers helps ensure that families can choose a childcare provider that meets their family's need. So this section identifies provider participation in the program to ensure that parental choice is maximized, how market rates are assessed and the cost of childcare is analyzed, how adequate program payment rates to providers are established, how payment practices to providers are implemented and timeliness of payments is ensured, and how supply building mechanisms are implemented.
Madeline Karst Batson, Louisiana Policy Institute for Children. Rochelle Wilcox, Wilcox Academy.
I'm Madeline Karst-Batson, Director of Policy and Research for the Louisiana Policy Institute for Children. The recommendations I have for Section 4 were generated by an informal working group of childcare providers, Ready Start network leaders, and childcare resource and referral agency leaders. In Section 4.4, I recommend that the department implement the CCAP voucher bonus system in the CCAP B3 program. CCAP bonus system has incentivized programs to improve their quality, and programs participating in both the voucher and contracted state programs should be similarly incentivized to achieve the highest possible levels of quality. In Section 4, I also want to note that in 4.2.1, the department was reporting on their market rate survey, and I just wanted to put some shine on the department. 81% of the registered family childcare providers responded to the 2023 market rate survey, which is encouraging, showing how the department has worked really hard to increase supports and relationships with family childcare providers. 67% of type 3s responded to this survey. And so I just wanted to point out the tremendous work that the department has been doing so far with family childcare providers. We also would just like to note that prospective payments and enrollment payment practices are supported by the new federal rule, final rule. The department, it says in the draft plan, has submitted a waiver for prospective payments. And so we just wanted to note that and also show encouragement that we are ahead of the pace of the federal government in some ways, even with how we have already implemented enrollment-based practices.
Hi, I'm Rochelle Wilcox, Executive Director of Wilcox Academy of Early Learning in New Orleans and co-founder of Fortified Providers. I recommend that the department implement the CCAP voucher bonus system in the CCAP B3 program. The CCAP bonus incentivizes programs to improve their quality. Years ago, there used to be a quality improvement fund that the early learning centers used to receive that has since gone away. However, by implementing this will allow centers to improve their quality of their centers by increasing wages, getting the curriculum that they need, all of those other wraparound services that improve the spaces that our youngest learners are going into. We see that those centers, we know that the class scores overall have increased. And I know that part of that is from the bonus that they already received with just regular CCAP. With getting the CCAP voucher bonus, this will initially support those providers and making those the highest possible levels of quality.
Shay Perkins, mom, PCECC. Jennifer Stevenson, Child Care Association of Louisiana.
For section 4, I recommend that the department check the box on 4.551 to prioritize the needs of rural children. Our rural community has few employment opportunities and fewer childcare spots. I personally drove 110 miles daily to make the trip from home to childcare to work. I wasn't even the only family from New Roads in the classroom, much less the center. Our most vulnerable children deserve to be prioritized.
Hi, Jennifer Stevenson, the Garden Knowledge and Healthcare Association of Louisiana. On page 56, it asks to describe how the lead agency will promote to providers regarding any changes to families' eligibility. And we recommend that notification or that you consider notification being made also through EdLink and or KinderConnect. This notification would be faster, more reliable, and more financially reasonable than relying on an unreliable snail mailing system. Describe other payment practices established by the lead agency. Oh, I'm sorry, not that one. Care for special population. On page 61, it mentions a smooth and timeless transition from early childhood intervention services through an IFSP to school-based services through an IEP. This transition is not smooth in all areas. St. Tammany Parish School System does this very well. Bogalusa City Schools does not. They make it extremely hard and nearly impossible for families to get services for their children. They have to come get the child from the child care setting, bring them to the public school, and once services have been rendered, bring them back to the child care setting. A lot of families decide to not do it because then they have to miss work. And if they miss work, it could also jeopardize their eligibility for CCAP. So my recommendation is that LDOE consider having some type of blanket guidelines that can be followed across the state, something similar to what St. Tammany does, as they do extremely well.
That's your time. That ends comments for section 4. We will now move to section 5. Section 5 is the health and safety in a child care setting section. Ensures that children attending child care are healthy and safe. And so this section identifies licensing requirements, standards for ratios, group sizes, qualifications for CCDF providers, the health and safety standards for CCDF providers, the pre-service or orientation training on the health and safety standards for CCDF providers, ongoing training and professional development requirements, the monitoring and enforcement of policies and practices for licensing and the health and safety requirements. It also includes the comprehensive background check, as well as exemptions for relative providers. And so some of those highlights noting in Louisiana that child to staff ratio for all types of centers are aligned, and the department holds monthly webinars, regularly revisiting and providing guidance as it relates to the health and safety in areas of concern. And so with that, we will now open public comment for section 5, which is pages 64 to 107. Dr. Silas.
Jen Roberts, Agenda for Children. Madeline Cars-Batson, Louisiana Policy Institute for Children.
Jen Roberts, CEO with Agenda for Children. Related to section 5, I have 2 sections I'd like to talk about. The first is that I do recommend that the state digitize Louisiana pathways. And in doing so, we would be able to ensure the regular collection and analysis of data on our early child care workforce. As the CCRNR and the lead agency, we see how valuable it would be for our teachers, directors, and professional development agencies to be able to have an electronic training registry. So that we could be able to ensure compliance on our end, directors would be able to ensure compliance with training requirements, and we can get better information about the training workforce, including basic things like how many teachers are out there in the region, where are they in their career pathway, and that would help us be able to tailor our offerings. The second thing is that I would recommend that the department create a model of training and coaching for early care and education workers who support students with exceptionalities, specifically those with special needs. Supporting students with special needs is a highly specialized skill set, and we know that general coaching and general training simply does not give teachers the amount of expertise and knowledge they need to truly support those children and their families, whether it's a seizure disorder or whether it is something like autism. For the past 6 years, Jennifer Richland has operated our Healthy City Seats program with a locally funded money with wraparound supports that provide additional services, which includes every center receives mental health consultation, early intervention, wraparound support, and care coordination for students with complex physical needs, as well as any sort of social, medical, or behavioral needs. And even with all of those extra supports, when we survey our City Seats providers in this spring and we asked what they wanted more professional development on, 95% of them said that they wanted more PD on supporting children with special needs, which is a larger percentage than any other topic we have. We've been really proud of the work that we've been able to do, and we'd like to see that type of support across the state.
I'm Madeline Batson, Director of Policy and Research for the Louisiana Policy Institute for Children. The recommendations I have for Section 5 are generated by an informal working group of child care providers, Ready Start Network leaders, and child care resource and referral agency leaders. In Section 5.3, I recommend the department develop a fully built out, monitored, high-quality health and safety training portal. Online modules are generally not an effective way of training, particularly for medication administration or other health and safety administration or guidelines or rules. They also create access gaps for low-income communities that may not have funding for devices. Any online module that is required due to not being able to access an in-person trainer by any means possible should be driven by a live human instructor that has modules with extensive post-testing to ensure that the person going through the administrative module is paying attention and actually learning and able to implement what they have achieved. There should be one centralized portal like Canvas or another learning management system where modules, feedback, and verified certifications are located. Training modules and in-person providers must be vetted and approved by lead agencies. The Office of Early Childhood could share credentialing responsibility with the Department Certification Office, which already oversees credentialing for school-based nurses.
Christy Gibbons, Kids of Excellence. Rochelle Wilcox, Wilcox Academy. I'll wait. Okay. Rochelle Wilcox Waves. We'll move forward with Parashay Perkins, Mom, PCE, CC.
Well, hello, I'm Christy Gibbons again. I'm going to talk about my experience as a director for over 25 years and being in early childhood and all the paperwork that we have. So I really hope that we can find a way. I have done a great job with digitizing at length. We have other programs that we work with other institute organizations and they digitize. I really think that we need to digitize pathway because when I first came in early childhood, my purpose was coming into early childhood was to spend time in the classrooms with the children. Spend time in the classroom working with my teachers side by side with them role playing, interacting with the children, talking to my parents, not sitting in the office, dealing with paperwork all day, filling out all this stuff, going to the mailbox and dropping it all. But I could imagine a system where I could just go input this information, have access to this information, just take directors out of the office in the classroom. And just imagine if we also build this system where we have this training modules that access for behavior management, all the things that we need to be better childcare centers, that directors could be in those classrooms reinforcing this, making sure the things that happen. When I got in early childhood, that's what I thought it was gonna be about. I didn't think I was gonna be spending 50 hours or 40 hours a week in the office. I wanted to be able to get back into the classroom, working with my parents and working with my teachers and building my children and knowing who the kids are and being able to talk to the teachers. I remember being able to talk to the teachers that, hey, that's a little child need a little bit more support in this. But now we're in offices doing all this paperwork. So just imagine a world with more digitized, everything digitized, and also training modules to help support us will really make us be, we already at the top in Louisiana as one of having one of the best systems of everything that we do in childcare. Let's get this done and we really will be number one.
I recommend that the department utilize its existing platforms to provide responsive training for health and safety. These would include robust checks for understanding. The department's already using Canopy really well. They have already utilized Canvas. They could administer health and safety training in a way that's secure, ensures that everyone is well trained, and then also send those clock hours directly to licensing so that we can be absolutely sure that the people who are watching over our babies are prepared in the event of emergency.
Pamela Marshall, Shiloh Gardens Academy. Tiffany Spears, Toddlers University.
Pamela Marshall, Shiloh Gardens Academy and Shiloh Gardens Academy and Early Learning Center. My recommendations is that the department create a model of training for coaching and for early care workers who support children with special needs. Children with special needs deserve child care educators and support staff who are well trained to support their unique needs. Generic training is insufficient for providing the quality of care these children need and deserve. I totally agree. Generic training is not sufficient to help our teachers who barely have CDAs or who are trying to acquire CDA at the moment. They're not getting enough training in those areas to deal with children with behavioral issues or special needs. Currently, we do receive coaching from Agenda for Children and mental health consultation. However, it has not been sufficient in providing the necessary skills that the teachers need to meet the needs of these children who are physically overbearing. Some of them are pretty strong and they really don't know how to deal with the temper tantrums that some of them they may have because they just don't understand structure or how to follow directions or what have you. Spending time in the classroom with my teachers has given me an insight as to what they deal with on a daily basis. And I find that they're overwhelmed and they become burned out. They become mentally stressed because they just not knowing how to deal with certain behaviors in the classroom. So I would like to see the department to prioritize training in the coming years to increase mental health and behavioral management presence in our schools and in our centers and in trainings in the upcoming years.
Hi, Tiffany Spears. I recommend that the department create a model of training and coaching for early care workers who support children with special needs. Basically right now, we're used to, some developmental delays, some mild behavior issues. In the day and time right now, we have severe behavior issues. As Pam stated that, me personally at my center over the last 7 months, I have dealt with a child with a major temper tantrum. She had temper tantrums for like 1 hour. She was fight and flight. We had to restrain her for that long period of time. She would kick, hit, scratch, bite, cuss, everything to the staff that tried to restrain her. We are not trained for that. It was beyond our capabilities. Redirecting didn't work, soothing, talking, back rubbing, none of those things work. So right now, we need to tailor training to what we are dealing with now in today's time. We can't use the backdated stuff from years ago because we're dealing with a different generation of children right now. We have also received a grant for children with disabilities, but some of those items require training, and we want to make sure we're implementing those techniques correctly. So the training will help our teachers and our administrators to better serve these students.
Demetrius Rogers, Tender Touch Nursery, Jennifer Stevenson, Child Care Association of Louisiana. Demetrius Rogers, Waves.
Jennifer Stevenson, the Garden Knowledge. Just to echo what everybody else is saying, I also agree about the training modules. One recommendation that I would like to make is that there's possibly a library in Edling. Someone else had mentioned that way it's already there. That's going to help expedite licensing inspections because the inspector would have that information prior, but also to Ms. Farashay's point, being in a rural area, we see with the mandated reporter training that if it times out because our broadband is awful, we can go right back in and it picks up where it left off. Whereas with some of the modules from LDOE, if you get timed out, you have to start completely over again, and it doesn't store that you did the training at all. So you can't go back to like a transcript like you can in the mandated reporter. So we would recommend that something like that be implemented, and I think that that would be very helpful on several fronts.
If that is it for comments related to section 5, we will now move to section 6, correct? Yes.
Yeah, so section 6 of the state plan describes efforts to support a skilled, qualified, and compensated childcare workforce. So this section of the plan identifies activities related to strengthening workforce recruitment and retention, a professional development framework for caregivers, teachers, and directors, and early learning and developmental guidelines describing what children should know and be able to do at different ages.
Madeline Forrest Batson, Louisiana Policy Institute for Children. Christy Gibbons, Kids of Excellence. How are you? Christy Gibbons, Waves. Rochelle Wilcox, Wilcox Academy.
I'm Madeline Batson, Director of Policy and Research for the Louisiana Policy Institute for Children. The recommendations I have for section 6 were generated by an informal working group of childcare providers, Ready Start Network leaders, and childcare resource and referral agency leaders. In section 6.1, I recommend that the department extend categorical eligibility for children of childcare educators and support staff, regardless of their income. Many of the qualified compensated activities listed in this section of the preprint are a few years down the line for our state. However, an immediate benefit to the early education workforce would be to reduce the burden of childcare costs for them. Kentucky has successfully implemented CCAP coverage for childcare educators independent of their income, and its positive impacts have caused several other states to follow suit. With an industry that has very little incentive for credentialed professionals to stay, coupled with the fact that lack of access to childcare is what keeps early educators from the classroom, implementing this policy would be a win for the industry and for the parent educators that hold it up.
Yeah. Oh, I'm sorry. Section 6. So I recommend that the department ensure that early educators have sufficient opportunities to complete their ECAC/CDAs within 2 years by allowing more than just one cohort a year. We are again in a teacher crisis, and only having one cohort a year does not allow us to help our teachers work themselves out of poverty. Once they get their CDA, then that gives them eligibility to make more wages. The fact is we want to be able to pay our teachers more. We want them to be educated. You've heard over today that teachers may not be equipped for certain things. The ECAC is the step ahead. We have a lot of new teachers coming into the field, and we want to be able to meet the need, especially giving them the education that they need in order to support the children across the state. The fact is, doing one cohort a year is just not enough for the amount of traffic that we have coming in. We want to be able to educate them, pay them more, and retain them. So we recommend that you ensure more opportunities for the incoming staff.
Shea Perkins, Mom, PCECC. Jennifer Stevenson, Child Care Association of Louisiana.
Morning. For section 6, I recommend the department expand the ECAC to multiple cohorts, to directors, and to teachers who earned a CDA out of state. We have a great teacher from Mississippi, but because she earned a CDA in a program that through no fault of her own was not Bessie approved, she now has to get an associate's degree in order to earn ECAC. This is really hard to do in a community where the only community college was shuttered due to COVID, remains closed due to asbestos concerns, and to reiterate, the lack of broadband makes online college a little difficult for an associate's degree. Thank you.
To go back to my point in the last section with the library of how-to videos, I mentioned that it would be helpful on many fronts, and this is just another one of those fronts.
Thank you.
There are no further comments related to section 6. We will now move to section 7. This is the description of the use of quality funds for quality improvement activities and the place to support all children in care, including training and professional development of the workforce, implementing early learning and developmental guidelines, the quality rating and improvement system, improving supply and quality of childcare services for infants and toddlers, childcare resource and referral services, program standards, and facilitating compliance with safety standards, evaluating the necessity of the quality and effectiveness of childcare programs, accreditation supports, developing additional high quality standards. I definitely want to acknowledge the tremendous growth as we've seen, our 15% in those class scores. And so with that, we will now open up public comments for section 7, pages 122 to 128. With that, Dr. Silas, please feel free to let us know.
Haley Bolton, New Orleans, FPAC. Megan Knapp, New Orleans, FPAC, Xavier University.
Good morning, everyone. I'm really policy action council. Section 7.2.1 of the CCDF draft aims to provide approved training and professional development related to child development, curriculum, and teacher-child interactions. Incorporating Farm EDC in these trainings is a valuable addition. Just for some background, Farm EDC is Farm to Early Care and Education, and it connects children aged 0 to 5 that participate in early care settings, such as a Head Start, to locally grown food. Activities such as gardening, taste tests, age-appropriate nutrition, education, and local procurement are examples of the benefits of Farm EDC. In addition, Farm EDC assists children with cognitive development, social skills, environmental awareness, and community engagement. Along with these benefits, the children are incredibly excited and enjoy these experiences. I've been working in schools with them, and as a result, the children are able to build an early foundation for healthy habits and choice. As someone, Christy in our network just stated, kids are hungry and they receive the majority of their meals at school. Making Farm EDC a priority helps children access those fresh local foods and have more autonomy over their choice for eating.
My name is Dr. Megan Knapp, and I'm with Xavier University, an assistant professor there. Our ask is to intentionally highlight Farm EDC in the CCDF plan and make it a part of the infrastructure that supports childcare in Louisiana. We recently conducted a survey of centers across the state representing 62 zip codes and 32 parishes. What we found is our only 14% reported the use of Go Knapsack, a program that provides self-assessments for providers to examine nutrition and physical activity practices and policies. And less than half were participating in CATFP. So there's an opportunity for increased awareness and participation through Farm to ECE programming. We did find that 95% of participants were interested in Farm to ECE, but they did report barriers such as insufficient funding, a lack of knowledge and training to implement Farm to ECE programming, and then over 40% reported that they did not know Farm to ECE programming was an option. Interestingly, 2/3 said they did not participate in Farm to ECE, but they did recognize that they were engaging in Farm to ECE related activities. So there's an opportunity for raised awareness there. And 73% wanted more training on the program. So by highlighting Farm to ECE in the plan, there's an opportunity to increase awareness of Farm to ECE resources, the use of Go Knapsack, and the use of CACFP to support Farm to ECE with the overall goal to connect kids to healthy foods. Thank you.
Madeline Batson, Louisiana Policy Institute for Children. Vershay Perkins, mom, PCECC.
I am Madeline Batson, Director of Policy and Research for the Louisiana Policy Institute for Children. The recommendations I have for Section 7 were generated by an informal working group of child care providers, Ready Start Network leaders, and child care resource and referral agency leaders. In Section 7.2, I recommend that the department create an early childhood data dashboard. The department collects various data points throughout the year, but stakeholders, including the legislature, have expressed difficulty in easily locating data on publicly funded programs. An early childhood data dashboard that shows trends over time would help with the following sections highlighted in the CCDF plan, which include evaluating and assessing the quality and effectiveness of child care services within the state, improving the supply and quality of child care services for infants and toddlers, and improving the quality of child care services and the measurement of outcomes related to kindergarten entry.
In section 7.2.1, I recommend that the department update its current KTM catalog to reflect the changes that have already been made to the pre-K class tool, as well as to the changes made to the early learning and development standards. I also recommend that the department put these KTMs onto one of its online platforms so that CCR and our administrators can administer these to sites. And I'd like that platform to communicate directly with licensing and pathways to log the clock hours received through those KTMs in a standardized manner across the state.
Jennifer Stevenson, Child Care Association of Louisiana. Slater, Toral Academy.
Jennifer Stevenson, Department of Knowledge and Child Care Association Louisiana. In section 7.2.1 subsection K, it says that it is a seamless process when switching from DCFS to CCAP. And this has not been the experience of providers across the state. We recommend outlining what that process would look like to ensure that the process is seamless, as DCFS does operate through regional offices. Some regions tend to get the memo and some regions tend not to get the memo.
Hello, just wanted to comment on discussing one thing is improving infant and toddler availability. We as a state over the last couple of years, few years, have made a lot of progress, trying a lot of new ideas. And I think one of them in B3, which maybe we could borrow and put into the CCAP and make it universal across all programs, is that having the child's age be determined at the beginning of the school year or the fiscal year in August or September, as opposed to just being whenever the child turns 1, all of a sudden they're dropped in their pay rates. And I have, if you want continuity of care, I'll have 4 infants in the class at the beginning of the year getting paid almost $600 per child to have them in the room, and then you can afford to pay your staff properly, etc. And as soon as the child turns 1, they go to $924. So all of a sudden, you just remove the incentive for centers to enroll infants in young ages because they're not going to get that proper rate throughout that year. So if the child is October or November, all of a sudden they get paid appropriately for what their service is providing for the first month or 2, but then it just drops off. So I think that's something we want to encourage. Increases in infants and toddlers being enrolled. It's something that we lock in the rate at the beginning of the year. That was done very effectively in B3, and I think it helped retain a lot of quality teachers and kept the kids with the same environment that they were able to grow in.
Restate your name for the record.
Yasmin Chesney. Slade Clark Academy, the center representative.
Thank you. That is the last of section 7. We will now move to section 8.
Section 8 of the CCDF state plan describes the lead agency's coordination and partnerships, including with whom the agency collaborates to provide services, how match and maintenance of effort funds are used, coordination with childcare resource and referral systems, and efforts for disaster preparedness and response plans to support continuity of operations in response to emergencies.
Haley Holton, New Orleans FPAC. Alan Parks Batson, Louisiana Policy Institute for Children.
Again, Hazel Holton, New Orleans Food Policy Action Council. This following comment was made with our work group, our pharmacy statewide work group. In section 8.1.1, the state's draft CCDF plan outlines partnerships with the Louisiana Department of Health, Department of Education, and the Division of Nutrition Assistance. In all aspects of these partnerships, the state could incorporate language that focuses on nutrition and healthy eating alongside the procurement of local food and the expansion of on-site gardening across childcare programs, all of which support the healthy growth and development of young children and ultimately meet the needs of working families. These partnerships could also work together to improve the uptake or compliance of CACFP among programs. As it relates to Farm to ECE, this could include a partnership with Well Ahead at the Louisiana Department of Health, which engages on Farm to ECE, as well as coordinating with the Seeds of Success program that the Louisiana Farm to School program funded through the Department of Education Division of Nutrition Support. I'm Madeline Batson, Director of Policy and Research for the Louisiana Policy Institute for Children. The recommendations I have for section 8 were generated by an informal working group of childcare providers, ready start network leaders, and childcare resource and referral agency leaders. In section 8.1, I recommend that the department expand and support the coordination of infant mental health /type services to CCRNRs. Several stakeholders have expressed that they do not have a depth of understanding as to how to best support infant mental health or what resources are available that they could be connecting families to. In regards to emergency preparedness, I understand that the department has an expansive document for providers to fill out in regards to unsafe intruders or violent intruders that have inadequately entered providers center. However, in conversations, a lot of times I hear that providers do not know about a community threat or either that's like biological or like chemical or an active intruder. And I would just suggest that if there's any way that the department could support connecting providers to local 911 services so that they can get alerted to, let's say, if the elementary school right next to the center is under lockdown due to an active intruder or another unsafe person in the community, that the provider is also notified to go in lockdown as well. Providers oftentimes express how they are only told about these intruders in the community or unsafe situations in the community if a parent calls. And so I believe that there is space to have an extra level of support and guiding providers to know how to more efficiently and more professionally receive information about active intruders or unsafe situations in the community.
Jennifer Stevenson, Childcare Association of Louisiana. Hershey Perkins, Mom, PCECC. Jennifer Stevenson Waves. We will have Yossi Chesney, Slater Toro Academy.
Good morning, Hershey Perkins. In section 8.3, I recommend that the department utilize a coordinated data system for all CCRNRs, something like WLS or NDS, or else build this into EdLink and then give the CCRNRs EdLink access.
Several things I'd like to bring up here. First of all, I think one of the things that's been really done well over the last few years has been the collaboration between departments, child research agency, various other networks, et cetera. And I think that's something that applies to both section 1 and section here, that we should do what we can to retain that collaboration, especially when it comes to buying the contracted seats, as they said, as the CCR aides already have a lot of experience with that. It's something that will prevent a lot of lapses in care, a lot of delays, especially that we know that sometimes, for many various reasons, the department can get overwhelmed a little bit in their influx of cases, whether it be a storm related or pandemic, et cetera. Providing this, retaining this ability by the local child care resource agencies or Ready Start networks would allow both to make sure that it's maintained in a much smoother fashion. Also, it would allow that the local agencies have a much better feel for what areas, whether it be ages or geographic, then there's a need. So they'd be better be able to target these seats, which is something that's been done in the B3 program. Additionally, I understand that there's maybe concern that we're going to be using one fund source and you have to be audited. So maybe we could just, in order to help with that, require that the child care resource agencies go through the same training system as the caseworkers from the state. This way you can get the same quality that you're looking for while retaining the flexibility that was required within the B3 framework. And additionally, I know that Orleans has, and I know Jefferson Parish we're looking towards, and many other parishes, local funding sources. I know that it's been a pain point for knowing, and I think something we should consider is that funds, as long as there's parameters of the system relatively aligned, we should do what we can to allow funds to be co-mingled and segregate each seat out. As I think this will allow agencies to much better address the needs.
That's your time.
All right.
That's your time.
Okay.
That is the last of the section 8 comments. We will now move to section 9. Section 9 describes the family outreach and consumer education section, and this includes details about the agency's child care consumer education website, as well as the process for collecting and maintaining a record of parental complaints. We will now open it up to comments as it relates to section 9. Dr. Science.
Haley Holton, New Orleans, FPAC. Madeline Parks-Batson, Louisiana Policy Institute for Children.
Hi, Haley Holton, New Orleans Food Policy Action Council. Again, the following comment was drafted with the Louisiana Farm to Eat statewide network work group. In section 9.3.2, we would like to comment, while the Louisiana draft CCDF plan does assure that information about SNAP and CACFP are available to parents, information about farm to eat, such as how the CACFP can be used to support farm to eat is allowable, could be included in the information. Additionally, the state does have a SNAP Ed program through the LSU Ag Center, which provides tools and resources to help SNAP recipients make healthier diet and lifestyle choices, such as through school and community gardens. Farm to ECE related resources could be incorporated as part of this information that's provided on SNAP and CACFP. And then in section 9.3.4, the state's draft CCDF plan discusses how the early learning and development standards are available online, and that the publication of guidance documents provide examples for developmental milestones. The plan also describes a family support library with resources and information about developmental milestones, health and safety, development, screening, and early learning. At the writing of this letter and comment, there did not appear to be information about food and nutrition or other resources related to healthy eating and lifestyle behaviors among families and children. One suggestion is to include resources and information to parents and families about healthy eating and nutrition. For easier navigation, this could be included as its own section in the Family Support Toolbox library dedicated to food and nutrition. Further, local, regional, or statewide organizations that provide this information could also be linked onto the website rather than creating duplicate resources. And Madeline Carr-Batson, Director of Policy and Research with the Louisiana Policy Institute for Children. The recommendations I have for Section 9 were generated by an informal working group of child care providers, Ready Start network leaders, and child care resource and referral agency leaders. In Section 9.2, I recommend that the department translate key early child education website resources with a certified human translator. Supporting families who do not have English as their primary language comes up several times throughout the CCDF plan. The department currently has a feature on their website that translates the text into various languages. However, many machine translations are confusingly inaccurate. Having a human translator would increase access to the materials posted on the ECE website. The priority would be to human translate high traffic documents such as family resource and application documents.
Mary Perkins, mom, PCECC. Jennifer Stevenson, Child Care Association of Louisiana.
Perkins. I recommend the department move from the current machine translated website to human translations. If you look right now on louisianaschools.com, the word director is translated erroneously because it's machine translated and hasn't been hard coded by a human looking at the words. We're a rural community. We have a lot of Spanish speakers, and it would help out tremendously if our Spanish language translations were accurate on our consumer facing website.
Hi, Jennifer Stevenson, the Garden of Knowledge in Bogalusa and the Child Care Association of Louisiana. On page 157, section B, describe the training to providers around CCDF program requirements and program integrity. It is our belief that LDOE should consider creating a video library again that can be easily accessed at all times. And we do recommend that these videos count towards the required 12 clock hours, but only once a year to avoid misuse of the videos.
Elsie Chesney, Snyder Toral Academy.
Right. This is more of a general comment. The Louisiana Blues website with the childcare, there's a lot of information needs to be cleaned up, and also links that are SEO and gets optimized. That when if you Google CCAP eligibility, the first thing that pops up is an old web page that has information from when we still can see 5% has SMI, receiving income. So that causes a lot of families to say, "Oh, I'm not eligible, I'm not applied," even though it should be eligible. There's information about TOTS, IVRs. It's a lot of clutter that should be removed to make it much easier to find what you're looking for. There should be better access to documents needed for applications, whether it be like right now, whether it be employee verification forms or other forms that help parents establish employment or job seeking. And then I submitted comments. I submitted a lot of like the things that I think need to be cleaned up. Obviously, it's not a comprehensive list, but I think that's something that should be focused on. But a lot of times you'll end up on a page which has some good information. So you think, oh, this is the right page. And then there's a lot of links in the sidebar or other pages, landing page that leads you to, which are very unhelpful and just can confuse the parents and child care providers and create a lot of issues with them providing the proper care and providing proper applications. And this also applies to the SNAP link that you have in there for the parents applying. They've on this bad page of the whole child care assistance program, which has all the information.
And that is the last of our section 9 public comments. We will now move to section 10.
Section 10 of the CCDF state plan describes strategies for program integrity, including internal controls and accountability measures. This includes procedures to reduce fraud, waste, and abuse, including program violations and administrative errors.
Jennifer Stevenson, Child Care Association of Louisiana. Madeline Carr-Batson, Louisiana Policy Institute for Children.
Hello again. There's a lot going on in this section. 2 minutes goes fast, so here we go. Using the Equifax system and analysis, that whole section, we really recommend that if you're able to do this and verify this information Sometimes we have families that just can't produce these documents and the department is already going back and using these systems to verify. So perhaps that could just be check boxes on an application and not require those documents since we already have access to that information. It would again streamline the process and potentially help more families qualify quicker. And as far as red flag reports, it's very concerning to be held accountable for something that somebody else does or does not do. And reading through the intentional violations and unintentional violations, these actions are done or not done by families, yet providers are the ones who are being held accountable. We have experienced across the state that requesting attendance logs for all CCAP children for an entire year due to one child being scanned outside of outside hours. So we do recommend that these investigations, when there is reason to believe that there might be fraud, that it only includes that family and for the day in question, rather than an entire year for all CCAP children. Again, it would streamline the process and the burden on the department and the provider.
I'm Madeline Batson, Director of Policy and Research at the Louisiana Policy Institute for Children. A general comment for just keeping integrity of our systems as we continue to look to run our CCDF plan, hopefully differently, with the recommendations in mind from Section 1 about extending operational duties to local entities, understanding that some entities haven't had to determine eligibility yet, that there will need to be some supports in place from the department that they haven't yet potentially had to do before. But just generally making it so that that doesn't hinder the department from granting some sort of operational duty to locals. We understand that locals will need to have supports to know how to best determine eligibility, to keep those documents in order and timely, so that audits come back clean. We know that there are some local entities that are continuing to learn what a clean audit looks like and how to best produce the best resource, the best eligibility determination. But the department has the capacity to train our locals to do this really well. And so this is just a general encouragement or recommendation to the department that instead of pulling back local efforts and autonomy and supports that you have worked so hard to build up over the last 3 years, that instead of taking it back out of concern for audits, that instead we use our efforts to really train and support local entities to know how to do these eligibility determinations well, so that we're doing best for our families and our children and doing right by the funds we get from the federal government.
Dear Shay Perkins, Mom, PCECC, Josie Chesney, Slater Toral Academy.
I recommend the department remove data silos and utilize an ESIDS, which is an early childhood integrated data system, to eliminate waste and to ensure the smooth coordination of state activities. Other states that have strong fiscal controls, such as Utah and Nebraska, have already implemented an ESIDS. By coordinating our data systems, we can streamline our operations. Returning to Ecclesiastes, chapter 4, verse 9, 2 are better than 1 because they have a good return for their labor. If either of them fall down, one should pick the other up. By coordinating our data systems with existing agencies, we must strengthen our fiscal operations and internal controls.
I would like to echo, I think, some of the comments we made previously regarding this. First of all, with the auditing, there's a lot of we had a lot of auditing due to lack of funds, I think, at the beginning of the year, but a lot of it was parents transitioning to a new system with the EdLink. So they were trying to backdate and they were doing AM instead of PM, PM instead of AM. So it looks like a child checked out at 2 a.m. That's out of hours. But I think that there's human eye can look at that and say, oh, I see how that error happened, and then just avoid having that audit, especially if audits are not just targeted, hey, can you send me the attendance verification for this child? It's, can you send me all your kids in your whole school for this entire month, which then takes process time to collect it and submit it and everything like that. I'm sure it's not easy for the department to do it either. So first of all, let's have some human approval of audits first, so before they can discard things that look like just errors. And if we're going to do an audit, do much more targeted than something that's just broad-based, send us everything, and just throw all the information in.
Great, that is our last public comment as it relates to section 10. We will move to next steps. Prior to moving to next steps, just want to acknowledge and thank you for sharing your input today. Comments received will be taken into consideration. Karen's going to speak over the next steps before the plan is submitted and the future amendments. And so she'll voice over the next step and timeline. Karen.
Thank you. And again, I echo, thank you for your input today.
You can be looking at your device as mine has just died.
Or your paper.
So we will refer to your paper.
But we've made it very, very close. So at least there's one slide to go. So we are still in May, barely, but we are still in May. In May, the draft of the state plan became public, the comment portal opened, and consultation with stakeholders and partners continued. The state plan draft is being presented today during this public meeting. May through June 2024, we consider the feedback we have received thus far and that we have received today while working to complete the plan and making any revisions we can make at this time. June 2024, the state plan will be submitted to the federal level for their review. Over the summer, July through September, the Administration for Children and Families Office of Child Care provides us as the lead agency with feedback on our proposed state plan, and the LDOE makes any further revisions needed at that time based on that feedback from the Administration for Children and Families. The new state plan for 2025-2027 becomes effective as of October 1, 2024. And we are then monitored in the subsequent year, and October 2024 and on, we submit plan amendments as new policy is developed and implemented in the state. And that is it.
And with that, no, I can't.